Welcome to RSCH503, Research Methods and Biostatistics, a 3-credit graduate course offered by Drexel University College of Nursing and Health Professions. Intervention-based research is important to expand the scientific basis for nursing practice. Such research verifies the efficacy, that is, the ability to produce a desired or intended result, the effectiveness, and the efficiency of interventions needed for the development of evidence-based nursing practice. The ability to find a statistical difference with any specific practice intervention is dependent on having enough statistical power from an adequately sized sample and on controlling sources of error and bias that can obscure study findings. Data from intervention-based studies have guided the development and use of evidence-based practice approaches, as well as the evolution of evidence-based guidelines. How does our profession define nursing interventions? Nursing interventions are described as deliberative, cognitive, physical, or verbal activities performed with or on behalf of individuals and their families that are directed toward accomplishing particular therapeutic objectives relative to individuals' health and well-being. Another definition sees nursing interventions as treatments, therapies, procedures, or actions implemented by health professionals to and with clients to move clients toward desired beneficial health outcomes. Nursing interventions are as varied as the multiple environments in which nurses practice. Some interventions are treatments, clinical protocols, or clinical tools used to improve patient care processes and outcomes. Other interventions are educational programs targeting nurses and/or other healthcare providers. Some educational interventions directly support patients and their families. Lastly, leadership interventions target staffing patterns and other initiatives aimed at improving the practice environment. In the clinical patient arena, staged-based interventions are tailored to a specific phase of a patient's recovery, response to treatment, or change in behavior. Intervention taxonomy is an organized categorization of the interventions performed by nurses. In the past several decades, a number of classifications of nursing diagnoses and interventions have been developed. This slide highlights several such taxonomies. The Nursing Interventions Classification, or NIC, includes over 500 nursing interventions. The Nursing Outcomes Classification, or NOC, is a comprehensive, standardized classification of patient-client outcomes developed at the College of Nursing, University of Iowa, to evaluate the effects of interventions provided by nurses or other healthcare professionals. Likewise, the North American Nursing Diagnosis Association 1, or NANDA 1, also collects nursing diagnoses and classifications. The NIC, the NOC, and NANDA 1 aim to collect and classify nursing interventions in order to improve patient outcomes. Intervention research methodology holds promise as a means of testing interventions. Such research shifts focus from causal connection, that is, studies that focus on providing evidence that an intervention contributes to an outcome, to causal explanation. That is, in addition to demonstrating that the intervention causes the outcome, the researcher must provide scientific evidence to explain why the intervention contributes to the outcome and how it does so. Such causal explanation is theory-based. Intervention theory involves understanding the problem, recognition of critical inputs, for example, activities to be performed, mediating processes, expected outcomes, extraneous factors, and delivery treatment system resources. In intervention-based research, efficacy refers to the ability to produce a desired beneficial, or therapeutic effect through randomized clinical trials, or RCTs. Experimental designs with stringent study criteria. Effectiveness of a treatment or intervention indicates that it is capable of producing positive results in a usual or routine care situation. Such studies may not be as stringently conducted as RCTs. The essential language of intervention-based research includes 4 specific terms to understand. First, treatment size effect. That is, what is the magnitude of effect produced by the intervention? 2, placebo and sham interventions. A placebo intervention is not intended to have an effect. Placebos are used to study how subjects would respond without actually receiving the interventions. Sham interventions are sometimes used to provide a fake intervention that omits the essential therapeutic intervention. Third, blinding refers to preventing disclosure of group assignment while a study is being conducted to avoid bias or undesirable influence in the ways subjects respond and researchers perform. Open label most often refers to RCTs or other clinical trials where subjects in the active treatment group are offered an opportunity to continue treatment, and those in the placebo or control group are given the option to transition to the active treatment at the end of the intervention period. Treatment fidelity is the adherent and competent delivery of an intervention by the interventionist as outlined in the research plan. 2 additional concepts are critical to understand with regard to intervention research. One is numbers needed to treat, or NNT. NNT, numbers needed to treat, is the number of patients who would need to be treated with the intervention to avoid one event that might have occurred with standard treatment. The analysis of intention to treat, or ITT, is based on the principle that subject data are analyzed according to the groups into which they were randomly assigned, regardless of what happens to them in the study. Intervention research must minimize subject dropout and missed interventions. The types of research designs used in intervention research include 2 categories. The first category includes experimental and quasi-experimental designs. The second category is the non-experimental design, including observational, retrospective, and descriptive. All of these designs may be employed in intervention-based research, depending on resources available and the research question or questions being raised. Design criteria have been established to evaluate the implementation of an intervention and outcomes. In addition to the detailed development of the intervention, an operational design should include a definition of the target population, the sampling plan, subgroups inclusion in the sampling plan, characteristics of the interventionists, definition of study variables with measures identified, time frame for study measurement periods, and statistical analyses to perform. Many factors may affect the integrity of intervention-based research and thus the validity of a study. Some of the key factors include 1. Lack of stringent study controls. 2. The general complexity of the intervention procedure or procedures. 3. The behaviors of the study intervener and staff variables. And 4. Study site variables. Pilot testing for an intervention-based study may help to identify such factors and allow investigators time to amend their protocol. This presentation was prepared for graduate nursing students at Drexel University College of Nursing and Health Professions. The primary book used in this research course is The Practice of Nursing Research, Appraisal, Synthesis, and Generation of Evidence, 2017 edition by Jennifer R. Gray, Susan K. Grove, and Suzanne Sutherland. This book is published by Elsevier Saunders, St. Louis, Missouri.